Can dysarthria after stroke be improved? Imagine struggling to speak clearly after a stroke and wondering if things can get better. The good news is that in many cases, dysarthria, which is a speech disorder caused by muscle weakness or incoordination, can improve with the right approach. Dysarthria happens when stroke damage affects the parts of the brain that control the muscles used for speaking, making speech sound slurred, soft, or difficult to understand. Recovery depends on how severe the stroke was, where in the brain it occurred, and how soon therapy begins. Speech therapy is the main treatment for improving dysarthria. Targeted exercises help strengthen the muscles involved in speech, improve breath control, and enhance clarity. For example, some therapies focus on practicing specific sounds or increasing vocal loudness. Techniques like the Lee Silverman Voice Treatment, which emphasizes louder, clearer speech, have shown positive results. Consistent, repetitive therapy over weeks or months can lead to noticeable improvements in how well someone can communicate. Starting therapy early, ideally during the initial weeks after a stroke, tends to produce better outcomes. However, even people who begin therapy months or years later can see benefits. Besides traditional face-to-face sessions, digital tools and smartphone apps are increasingly being used to make speech therapy more accessible and flexible. These tools offer exercises and feedback that can be done at home, helping maintain progress. In addition to formal therapy, practical strategies can help people communicate more effectively in daily life. Speaking face-to-face, reducing background noise, giving context before speaking, and using written notes or communication devices can make a big difference. These strategies help ensure that conversations are more successful and less frustrating. While research shows promising results, it is important to remember that each person's recovery journey is unique. Some studies highlight the need for more high-quality research to determine the best therapy protocols and long-term benefits. Still, personalized therapy guided by qualified speech-language pathologists remains the most effective way to improve speech after stroke. In summary, yes, dysarthria after stroke can often be improved through dedicated speech therapy and supportive communication techniques. Early intervention and consistent practice are key. If you or someone you know is dealing with speech difficulties after a stroke, consulting a speech-language pathologist is the best step to develop a tailored plan that offers the greatest chance for recovery. Always remember that individual results vary, and ongoing professional support is essential for achieving the best possible outcome.